we normally perform ACL reconstruction as a day case procedure. So, the anaesthetist gives a nice nerve block, and then we give local anesthetic around the knee. So patients can actually go home the same day. So they come in the morning, usually, be able to go by 7 in the evening. Okay. It is a bit swollen and sore. There's a bandage on, but by 2 weeks, you'll find the swelling will have come right down. And usually people are doing physiotherapy throughout that period, and they're starting to really make progress. But by 6 weeks is when you normally get seen again by your surgeon. Swelling should be down. Patients should be getting full extension, straightening the knee, and might still be using a crutch, though it's often they're not, but really making progress. And then it probably takes another 6 weeks after that. It's about the 3-month stage when people are sort of walking completely normally and there's not really any swelling left in the knee. Yeah, I mean, this depends on the sport. So a lot of the people who come to us with ACL tears, they're young people playing pivoting sports, cutting sports, we call it, with side-to-side movement, lots of change in speed and direction. And particularly if it's a contact sport like football or rugby, we're talking at least 9 months to 12 months. I will allow jogging in a straight line at 3 months, but we want that new ligament to really heal into the patient's bone, because what we're doing is taking normally a part of tendon and we're putting it through the shin bone and the thigh bone. It takes about 9 months to 12 months for it to really, heal properly. So I would say, depending on your sport, 9 months to 12 months, and we're talking netball, hockey, football, rugby, American football, anytime when you're stopping and changing direction. I think they need to have a stable, strong, pain-free knee. Good range of motion, good muscle control, and studies have shown that about 83% of elite athletes, return to their sport at a comparable level. So there is a potential for difficulty to return to sports, and we do have to warn people they might not get back to the exact level that they were before. But if it's a sport that requires that sudden change of direction, I think there's almost zero chance of getting back without the ACL reconstruction. So I'd say, once the patient's got no pain, nice strong knee, and really it's a physiotherapy program that gets to be followed. And once the physiotherapist is happy, they've got right through all the stages, they'll be able to return to sport. It depends on the sport, and it depends on how they get on with the physiotherapist. Because I say ACL reconstruction, the patient really needs to be compliant with the surgeon's instructions and the physiotherapist. There's the surgeon doing their job to do a technical, correct procedure, but then probably the majority of the rehabilitation is due to a good physiotherapy team, and ACL physiotherapy is quite specific. And say I get patients sometimes from football clubs, they will have physiotherapists within the clubs, and these sort of things have happened before. So what they will tend to do is they're coming up to about 9 months, 12 months post-surgery. They'll be doing sport-specific drills. So they'll be, say it's football, they'll be cutting back and forth, maybe dribbling with the ball. They'll be doing single hop jumps. And when their muscle strength is equal on both sides and the range of motion is equal on both sides, and really important, the patient can really feel their knee, they can feel the coordination, which way they're going, then I think they're ready. But I think, there can be a problem if you go a bit too early, because some people are really keen to go back. But actually, a lot of people are really educated now, and they know they've got to really look after that reconstruction to get back to the sport they want it's difficult to put an exact number on it because there's so many different factors. So I think the more important thing is, what are your risk factors for doing it again? So there are gender influences. So unfortunately, females have higher risk of rupture than males, particularly if they're doing the cutting sports such as football, because just of gender specific anatomy differences, ligaments tend to be slightly looser or lax, as we say, and particularly people who have hypermobility or hyperlax ligaments are a slightly higher risk of re-rupture. The younger you are, the greater the risk of re-rupture, because you've got more time to play that sport, and there is more possibility of having an injury. So particularly younger females or any young athlete really. And then I think really, like we said before, if you return to sport too early, before the new ligament is fully healed, then you're at higher risk. And I think it does depend on the sport. So, and what level you're playing. So if you're playing a contact pivoting sport, such as football, and you've got those risk factors on top, you're at a higher risk. But I see all sorts of sporting people, from the weekend warrior to the triathlete, and if you're sensible, return to sport should go well, and your risk of re-rupture, I'd say, was fairly low. So it's difficult to put an exact number, but I would give people, their risk depending on those factors.